As a healthcare professional over the last 20 years, I've been involved in healthcare policy, healthcare administration, and being an advocate to advance better outcomes in healthcare. However, today I'd like to speak to you as a parent of a very bright young man who had excelled at everything that he ever attempted. And his last year or two in high school, he changed dramatically. His attitude, his behavior, his aspirations. It was just a rapid change. And we attribute it to just being a teenager. We attribute it to the stresses of in a competitive high school environment. And I personally attribute it to peer pressure. And I was just convinced that he was really maybe involved in things he shouldn't be involved in. We've taken him to a number of psychiatrists and counselors and mental health professionals. He's been diagnosed with ADHD and depression and anxiety, and prescribed the requisite medications, and treated for over 2 years. He completed high school and goes off to college at West Virginia University. And his first semester, he totally crashed. He was exhibiting symptoms of paranoia, hallucinations, memory loss, and he would actually go into rages. And we were just really, as parents, at our wits' end. We didn't know where to turn or what to do. I had the good fortune calling on and working with various physicians in the community to have met Dr. Elizabeth Stoller. And Dr. Stoller is an addiction psychiatrist who takes a very comprehensive, integrative approach in the way she approaches her patients. And she is also a clinician with the Amen Clinic. And she has routinely integrated the Amen Clinic method of assessing and addressing psychiatric conditions using a comprehensive approach supported by brain imaging or SPECT imaging. When we found Dr. Stoller, it was just really a godsend, because as it turns out, she did all the assessments and analysis, and she immediately ordered a Lyme test, a psychiatrist ordering a Lyme test. As it turns out, David was full-blown positive for Lyme and diagnosed with chronic Lyme disease. And that was the beginning of our path, to getting our son back, to getting our life back. And Dr. Stoller, along with one of the Lyme physicians in the community, began to treat David using very integrative and complementary modalities to include a range of nutraceuticals and supplements. And David's been in treatment for over a year. And I'm here to report, and I'm extremely excited to report that not only have we gotten our son back, David is now back in college, after losing a full 18 months. He is back in college at Towson University. And we just got his first report, and he's actually on the dean's list. So, so for all the parents out there who have suffered, who are suffering, who've gone through, what we've gone through. And what is particularly scary about all of this is that he would have been carrying this burden. He would have been carrying these diagnoses. He would have been carrying these ineffective treatments for his entire life, and who knows if he would have ever recovered. But because of Dr. Stoller, and because of the pioneering work that Dr. Amen is doing in the field of psychiatry, mental health, and whole body health, because of the use of neuroimaging, SPECT imaging, which he pioneered since 1991, over 81,000 scans to date, from patients from 93 countries. And he has perfected this integrative approach of looking at the biology, the sociology, the spiritual, the whole person, if you will. And it's so critical that everybody who needs this, every parent out there and every child out there that's suffering because we are not looking at the very organ that's being treated. I want to say that there is hope. You no longer have to suffer in silence. And I just thank God every day because we got our setback. And I will forever be grateful, to Dr. Stoller and Dr. Daniel Amen, for the work that they're doing. And again, I thank you.